Good evening. A multi-million-pound investment to cut hospital waiting lists in parts of Kent have seen a dramatic drop in referral times, with some patients receiving potentially life-changing tests within days.
The West Kent Community Diagnostic Centre has been fully operational since March, but staff say it's helping to free up capacity in hospitals, which is vitally important as we approach winter. Well, the unit in Maidstone is one of dozens that have been created in Kent and Sussex as part of a wider NHS programme. Here's James Dunham.
3, 2, 1, blow. Keep going, keep going.
Giving the NHS breathing space one test at a time. Clinicians are beating the backlog which built up during COVID, with patients being examined faster in a facility far more calmer than hospitals in Maidstone and Tunbridge Wells.
Makes you feel confident, makes like, especially what they do for you, you are quick, and it makes you feel a confidence and does make you feel better.
I saw the GP a couple of weeks ago, and she referred me to the hospital, and I got an appointment today, and I'm very pleased with that. And no waiting at all, not much.
Here it's so lovely, it's so relaxed. It's just a different world. In fact, my friend who's just dropped me off said, "Is it a private hospital?" And I said, "No, it isn't. It's the NHS at its, well, very, very best."
The West Kent Community Diagnostic Centre was set up in 2021, but has been fully operational since March. Across 2 units with one site's purpose-built, procedures from ultrasounds to X-rays are carried out on brand new equipment.
It's fantastic for us because they break down less, and it's fantastic for the patients because since this has opened, the waiting list has gone from a year down to non-existent, so people don't have to wait for lung function tests now. So they're referred and then we book them in as soon as we can.
You've been in the NHS now doing this job for 15 years. Have you ever seen such an advancement in how care is delivered such as this?
No, I think this has just made such a wonderful difference, and I think it's certainly the future of healthcare, getting things much more based in the community, much more accessible, and patients who don't need to be in those kind of often busier, scarier, more acute and bigger centres can actually come to somewhere like this that's a lot more relaxed.
In a health service often referred to as tired and in need of investment, more than 30 community diagnostic centres have opened across the South East in the last few years, with many like this one available to patients 12 hours a day, 7 days a week. The centre has doubled radiology capacity specifically, but overall 150,000 tests across all areas are able to be carried out each year. The facility in Maidstone is one of the top performers in the UK, with the wait for an X-ray between 24 and 48 hours, a CT scan between 7 and 10 days, and an ultrasound 10 days, compared to many weeks and months before. In the context of NHS capacity, that genuinely is extraordinary.
It is, and what we're able to do is earlier diagnose, so therefore we're bringing patients' pathways and their times down. It allows us to concentrate on on our sickest patients, our inpatients, our A&E, our surgical-based patients, those really, really critically ill. This gives us the ability to remove that pressure. So we've still got main site running, but we're able to divert those patients down here, show them a first-class service, get them in, get them out.
People shouldn't be worried that this is taking resource out of hospitals.
Absolutely not. Actually, it's been additional investment into the specific community diagnostic centres, and it's allowed us to manage the resource across the acute sites and through the CDCs in a much more planned way.
Community diagnostic centres form part of an NHS drive to improve care. There's even small touches like relaxing displays and walls painted with dementia-friendly colours, and patients are seen so rapidly, waiting rooms can sometimes be empty. James Dunham, ITV News, Maidstone.